So every minute you save when you treat a stroke patient, you save almost 2 million neurons. 2 million neurons, and it's not just saving neurons or brain. Your likelihood of converting the treatment into functional outcome or functional independence so that the patient can have a meaningful rest of his life is what we are seeing when we do these kind of things and when we are trying to treat them early.
Once the patient is received in the ambulance itself, the patient is in direct visual system with the emergency physician in the command center. First thing is that. So once the patient is received into the ambulance, the monitors are connected. Basics like ECG and RBS were taken. So we are not wasting any time on the basic investigations. And also we have the complete information before the team or the patient reaches the hospital. And the emergency physician who will be communicating between the doctor and the patient will add on some medications if required as a life saving, and also if some of the times the patients are very sick, so he will do an added or necessary interventions on the way, and he will make us ready.
So whenever we have a patient who has a significant amount of neurological deficit that which has who has weakness along with speech disturbances or facial deviation, we know that patient has a bigger stroke. So when patient has a bigger stroke, we suspect that the patient may have a blocked blood vessel in the brain which needs to be opened as soon as possible. So we give high priority to angiographic sequences, that is looking at the blood vessels in the brain in the imaging or radiology sequences. And then once we look at the blood vessel that is blocked, we plan the procedure, go ahead and open the blood vessel by neurointervention.
So when you have a coordinated system where you can track, guide, monitor this patient's transport to the hospital, there I think you can make a lot of difference in saving time. Once the patient arrives to hospital, you're not bothered about all these things which can be done in the ambulance itself, like securing IV cannula, checking vitals, checking the blood sugar, and basic assessment of the sensorium. These kind of things, registering the patient to the healthcare system. So if these kind of things can be done in the ambulance itself, you can save at least 10-15 minutes of your hospital time, and the treatment can start right at the doorstep of the hospital.
An integrated stroke center ensures that we have this capability to react fast to the patient's condition and provide him all the necessary treatment as soon as possible.
In the emergency department of AIG, we have all the drugs available. If the patient needs thrombolysis, we'll do it immediately. If the patient needs thrombectomy also, we can directly move to the cath lab.
The other form of treatment involves an advanced cath lab where we access the vessels inside the brain through a small hole in the hand or in the groin. From there we take up all the hardware, the catheters, to the brain, and we put a stent retriever with suction. We take out the clot so that the blood flow is resumed. That blood flow is resumed, and that part of the brain is not damaged, or even if it is damaged, the damage can be minimized.
A patient coming to us within 2 hours of having some vision abnormality, and then we were able to react very fast. We were able to, the blood vessel supplying the vision area of the brain was blocked. We were able to open this blood vessel in half an hour, 30 minutes. And the patient made complete recovery. His vision was completely normal by the time of his discharge.
Now 1/4 to 1/5 of the cases, of the stroke cases, are happening in this young group of around 40 years of age. So it's our responsibility to protect this workforce and then to have the demographic advantage as a country we have.
I remember one elderly gentleman who came with a very high NIH score with right and left limb paralysis. Our scan a patient from emergency to the CT, the downtime levels are way below 15 minutes. In this patient, we made it below 10 minutes, and we could able to reach the thrombolysis state, that is the drug given, within 30 minutes. That is a very phenomenal number. And generally the patients who is having a high NIH score, the recovery rate will be compromised. They might survive but compromised. But this patient went home walking. I still remember his face and the smile he had when he left.